Hi, everyone, and welcome back to the Restore Lab. This is a functional medicine and functional nutrition podcast where we talk about all things health as multidimensional. And I am purely elated to have a really special dream guest on today. I'm joined today by Dr. Joe Tatta. Joe, thank you for being here.
Thank you for the invite, Sarah.
Thanks for coming and traveling all this way to be here with us. I just want to introduce you and then we'll get started.
Sure thing.
You and I are going to be talking a lot about pain today and kind of using an integrative therapeutic model for addressing pain as PTs, which is something that's near and dear to my heart. A little bit about Joe. You're an incredibly accomplished doctor of physical therapy, also a certified nutrition specialist, which is so cool. And you're really a pioneer in the field of using safe and effective interventions for the management of chronic pain. Just really an underserved area, I think, that needs a lot more of you. So you're also the CEO of the groundbreaking global health organization called the Integrative Pain Science Institute. And you guys are using evidence-based medicine to really translate the research into practice and then also educate practitioners like myself on how we can do that. And that's so important and so necessary. You're the best-selling author of 3 books. One of them we have here, The Heal Your Pain Now, which I've dog-eared a bunch, and also it kind of looks like my dog peed in it with how much I've highlighted it. But I use this all the time in my practice. It's really an incredible book. Also Radical Relief. And then you co-authored a textbook, which is called The Integrative and Lifestyle Medicine in Physical Therapy.
I did. And I always want to mention my co-editor, Ginger Roger, who was on that textbook. And then I think we had 40 physical therapists who contributed to that. So I always like to bring the team into that and thank them. And of course, just kind of raise awareness around everyone's contribution to that important textbook.
Yeah, I mean, writing a textbook, that is any book, but especially a textbook, I think that's such a labor of love with integrating all of the research. You are a big podcaster yourself. That's actually how I came to find you. So you're the host of the Pain Science Education podcast. I actually found that podcast in 2017.
Wow, that's early.
That was how I found you, and then I've kind of been following your work ever since.
So I started that podcast right as this book was released.
Oh.
Because the publisher said, the book is great, but you have 2 choices. You can start blogging or you can start podcasting. And I love writing. Mm-hmm. I've written 3 books, but I also love talking to people, which is why I'm here today and excited to talk to you.
Yeah, what I like about it is that it's talking about nutrition, but it's also talking about a lot of other lifestyle and other modalities that are integrative for really helping patients with chronic pain in a lot of different areas. Then you've co-authored a bunch of peer-reviewed papers as well. The one that I felt was really helpful to me was you led the APTA's task force on that integral paper in 2022, the critical role of nutrition care to improve pain management, global call to action for PT practice. Basically like, okay, we need to start integrating nutrition into PT practice, and this is why.
Right.
And when I saw that, I was like, I don't know. For me, I think I was feeling a little bit alone in what I was doing, and I was like wanting to do this, but you were putting words to why we needed to do that. So I'm really grateful for that. You highlight that the APTA says in our Practice Act that nutrition is part of the professional scope of practice for physical therapists. And this is that direct quote. It is the role of the physical therapist to screen for and provide information on diet and nutrition for patients, clients, and the community. So, it's in our Practice Act, it's in our scope of practice, and yet most of us don't know how to counsel patients on nutrition. So I think these conversations are so important. Side note, I just signed up for your Functional Nutrition for Chronic Pain practitioner certification program, which I am so excited to dive deep into because similarly, I think it's really going to help me translate the research into my practice when that can feel like a little bit overwhelming. Yeah. So thank you for that.
You're welcome.
I can't wait. So let's dive deep into talking about pain.
I appreciate your introduction, by the way. Thank you. And, I just want to say, obviously, we're 2 PTs, 2 physical therapists, talking about, pain first and kind of nutrition next, right?
Yeah.
And I just can't think of a profession that is more centered to address the growing chronic pain epidemic we have in this country. So I appreciate this podcast and, us cultivating this message together so we can, of course, reach other physical therapists, other professionals, but of course the people who need it, which
Yeah.
are the people in pain.
And I think that the people who don't have the voice or don't know where to start or don't know where to go, we're going to be talking about some pragmatic things that people can get started right away, which is why I like the lifestyle piece, because it puts the control back into patients that are having pain. So I think that's incredible. So let's get into it.
Let's dive in.
Let's dive in. So how about you tell us a little bit about your journey into starting to use nutrition? When did you start to use nutrition in your PT practice?
Many years ago, probably, if I had to put a number on it, it was probably 2000, 2001, somewhere in there. So a long time ago.
Yeah.
And it was purely by accident. But like yourself, seeing more and more chronic pain in our practice, seeing more and more people trapped in our medical system, where they're going from practitioner to practitioner, doctor to doctor, really without finding any kind of relief for their pain. And we know as physical therapists, oftentimes by the time people get to us, we're the last resort.
Right.
So people come in, they say, I've had all the x-rays, I've taken all the pills, I'm on polypharmacy now, which means they're on multiple medications. They've received injections, and I still have this pain. What's going on? And of course, let's not forget, and there's a role for this, but sometimes people are segued into mental health because they're told, well, this is all in your head. And there's a place for mental health, of course, in pain care.
Yeah.
But before that, for many people, there's a place at looking at some of these lifestyle factors that we're talking about, and nutrition is key. So I'll tell you a quick story, a quick case study. A patient who came in, she had rheumatoid arthritis, and she had bilateral knee pain. And she had CMC pain in both joints. We know RA can affect your thumb joint, your carpal metacarpal joint.
Yep, symmetrical.
And, we were talking, and she'd already seen multiple practitioners, multiple physical therapists, actually. So I started the traditional physical therapy, strength, range of motion, function, all the things that we do. And then one day we were talking, and she's, because we spend a lot of time with patients, right?
Yeah, yes, exactly.
Which is great, because we have time to educate, to counsel, to get to know people. And she said, you look like you're in pretty good shape. What do you eat? And this was really before, nutrition. My mom's a nurse. Nutrition has always been part of my home and my life. Yeah. But we just started talking in general. And she said one key phrase I'll never forget. She said, what's the most important thing I can do today in changing my diet? So I said, take added sugar out of your diet.
Yeah, I would agree.
Yeah, just that one thing. And then, to you and I and to, the practitioners, we know where added sugar is. Now, people think, sure, I can add spoonfuls of sugar to my coffee in the morning, but it's also really in almost every single package and processed food.
It's hiding everywhere.
Everywhere. So we started to kind of really unpack, where is the sugar? And it was eye-opening for her, and she was obviously ready to take that step.
Yeah.
And I'd say within about 2 weeks, she comes in and she's like, look at my hand. And the swelling in her CMC joint had diminished significantly. And then about a couple of days later, because I've seen her twice a week, probably about a week later, she's like, my knees feel less stiff in the morning. So now, of course, traditional physical therapy has an impact on that.
Sure.
But when you combine it with what we know from nutritional chemistry, nutritional biochemistry, it becomes a really kind of powerful combination. So from there, I got interested.
Yeah.
And I was like, let me start to look in PubMed. Let me start to look at courses and things like that. And from there, started the trajectory of where we are here today. And
I really would say you're a pioneer in that, because people weren't doing that back then whatsoever. I don't think in the PT practice. They really weren't. I mean, back in early 2000s, especially in physical therapy, there was definitely an awareness of nutrition. But it was really centered around health promotion. Right. And general. General prevention of what we know as non-communicable diseases. Yeah. So things like cardiovascular disease or diabetes. And those are super important when we have a topic of nutrition and pain. Yeah. But it wasn't focused the way you and I are focusing on it today in this podcast and in our practice, kind of focused on pain. So I really started to look around, and there were things in the literature, but not the way it is today. Yeah, yeah. And now there is more and more research coming out. And I mean, papers that you've co-authored, we're talking 2019, 2020, 2022. And so this is new stuff that, again, what you're doing really well is translating things to practice now. I've read some crazy things. It takes 17 years for research studies to really translate into most medical practice.
It does.
Is that,
yeah.
Am I right
So
in
it's
that?
interesting because I love writing papers, and I'm fortunate that I've had some published and had some great collaborators, educators, and researchers on these papers. And I was excited to see them in our professional journals. But the translation of knowledge, as you say, from that journal into DPT education, then into the clinical environment can take a decade or more. I think podcasts like this allow us to speed that message up, but it's still slower than we need it to be.
Yeah, I feel like it shouldn't take that long, because how many people are we not helping that we could help?
Right.
You know, you mentioned that you had a capstone paper and that you had written when you were in school. And was that on nutrition?
It was. So way back, so for the PTs that are out there, I originally had my bachelor's degree in physical therapy.
Okay, yep.
And then I went back for my transitional doctorate to a great TPT program, Arcadia University in Philadelphia, Pennsylvania. And we had a health and wellness promotion class that we took. And as part of that class, there was a capstone project. And I was already into nutrition, and I turned to Professor Kirsten Pollenbarrow, who's a good friend and colleague now. We do a lot of research together. And I was a little shy about it. I said, I use nutrition in practice, and I've seen some really good things with musculoskeletal pain. Can I do a capstone project on nutrition? And she was like, I think it's a great idea. So I put together this paper. It was probably, maybe 15 pages based on evidence, obviously, over 150 citations. And she said, this is quite good. She's like, why don't we submit it to a journal, to a physical therapy journal?
Yeah.
And I said, great. And this was the first, I had never published anything before, right? So I'm new to the peer review process. So I sent it to a couple of well-known journals that we know in the physical therapy world. And as part of the peer review process, our peers, other physical therapists, read it, and they send you feedback. And I was excited. I was like, wow, potentially a paper could be published on nutrition.
Which would be huge.
Which would be huge. And I was shocked at what came back.
In the feedback, what was the feedback?
So the feedback was physical therapists don't use nutrition as an intervention. There's no dietitian on your paper, right?
Yeah.
Right.
A lot
so
of people
we have
need to
our
see that
scopes
word.
of practice, and we have our silos that we still kind of, that I believe should be more permeable, and we're getting there, but they're not quite there yet.
Yeah.
And after I think I submitted it to 4 journals. And I said, hey, Kirsten, because she's more familiar with the peer review process. And she said, you're a little early, I think.
Yeah, it's like the world wasn't ready for it yet.
The profession wasn't ready for it yet. So just sit back. So, kind of felt like I put all this work into this, part of my doctorate degree, essentially. Right? A big part of my doctorate degree. And I said, kind of feel a little defeated.
Yeah.
So I'm like, okay, what do I do with this? So I let it sit for a couple of months. And then I noticed the opioid epidemic starting to really kind of heat up in the news. So I created a book proposal on a kind of a holistic approach to pain, on how to treat chronic pain, not just about exercise, but about nutrition and mindset and all the things that we know now. And I took that paper and I said, I'm going to now expand on this paper and I'm going to put it into that book. And that book is the book that we have here today. So the 3 chapters that are in that book on nutrition, really that paper was the precipitous of that, was the start of that.
Wow. Well, what I love about this is that any person can take it off the shelf and follow your plan. It's the most pragmatic. You're giving lists for shopping. You're giving lists of where to see added sugar. It's the most pragmatic place that I think any person could start. So I think that ended up working out better, quite frankly.
Right. In hindsight, I think it did as well, because more people have definitely read this book than will ever read a published paper.
Yeah, not everyone's diving into PubMed so much like we do sometimes.
And I had the opportunity to make the science more easily digestible for the consumer. But what I didn't realize was I was also making it more easily digestible for practitioners as well. And that's when I started to get emails and people would say, I read your book. I do some of this already, but I'm interested in the nutrition part. And that's how I started obviously writing more papers and training physical therapists in nutrition.
And that's so now I think probably steadily you've seen this like slow increase. And maybe now you mentioned that there's been like this recent surge in people being interested in seeing the benefit of it, like practitioners like myself. In this, you also have a whole section on how the brain is related to pain. And I feel like let's talk about how the brain is related to pain modulation first, and then maybe we can delve into how nutrition plays a role in pain modulation. Could you tell us about that?
Sure. I mean, ultimately, the brain is the organ that processes information, and it takes that information and decides, is this information threatening or dangerous, or is this something that's safe and pleasurable? When things are kind of threatening and dangerous, harmful to the brain or to our body, your brain creates pain as basically an alert, right? Kind of this like signal that you're in danger or potential danger. Now, everything comes up through your body into your brain, and your brain gets fed all this information.
Yep.
Right? So we know obviously things that come in through your visual field get fed to your brain. What you hear gets fed to your brain. What we sense in our skin and in our joints and our muscles, that gets fed into our brain. And our brain processes all this information and then ultimately says, okay, where am I here? Is this threatening? Is it not threatening, essentially?
Yep.
Now, the one thing that many people forget is that when we eat, we take in food or information from the outside world.
Yeah.
Actually into our body. So our digestive tract from our mouth to our anus essentially is an open tube that we're taking information in, right?
And because food is information.
Food is vital information. That's right. Now our brain wants to know what's happening there. So if we go way back, like kind of from an evolutionary perspective, we need to know if the food we're eating is good for us or if the food we're eating is dangerous or threatening to us potentially. So it could be something that's spoiled. Or it could be something that has a harmful pathogen in it that could, harm
Bacteria.
us. Yeah, many of us have food poisoning. That happens. So your pain processing, your pain system, your digestive system, your gut is a really important part of that pain processing system. So that's kind of the first place we should start.
And a place that I feel like most people don't know that.
They don't. We put a lot of emphasis on the brain, which is important. Right? Our brain has about 86 billion neurons or nerve cells, right? That's important. We can't ignore that.
Sure.
In our gut, we have a microbiome that's between 10 and 100 trillion cells. So we have 86 billion neurons in the brain, and let's just say for argument's sake, 100 trillion neurons in the gut, right? So essentially we have another organ down here that's responsible for processing information and processing pain in many ways.
And we often do call it the second brain.
Yeah, our enteric nervous system, which is in our gut, it's a bundle of nerve cells.
Yep.
Outside of our brain, that's the largest bundle of nerve cells that we have in our body.
Yeah, so then the interaction and that's kind of an interface of food from the environment and our own body. And like you said, how does that interact, and what is it telling ourselves to create health or to move towards the signals of pain or potentially chronic issues over time.
Yeah.
And then the vagus nerve is related to that as well, right? With that bidirectional nerve, gut to brain, brain to gut.
Yeah. So I love going back into the, our neuroanatomy, which we both taken.
Yep.
So we have this vagus nerve, one of the largest nerves in our body that runs from our gut, also connects with our heart and our lungs, our pancreas, our liver, and all that runs up right to our brainstem.
That cranial nerve number 10.
Yeah, and communicates with a lot of the same areas that are processing pain, basically.
When you start to look at those mechanisms, it's like, oh, okay, like that makes sense. The functional medicine world is so huge on going back to the gut as, kind of an upstream thing that we can modulate in trying to reduce pain and chronic issues.
Yeah.
So knowing the impact that it has, how can we use nutrition to modulate pain in a good way?
Yeah. Well, there's another step I think we probably should talk about and unpack a little bit in the gut is modern pain science tells us that chronic pain is not just a condition of the nervous system, but also the immune system. So there are neuroimmune factors that are involved in every single chronic pain condition. I think for the layperson, they view our immune system as these cells that are circulating around, these white blood cells that are circulating around our body. And that's true.
True.
However, most of our immune system is in our gut. because it's protecting us from the outside world. It's creating that barrier.
Yep.
So your immune system, along with your nervous system, has the ability to modulate pain from your gut and influence, obviously, what's happening in your brain and nervous system.
And I think also from like that physiological perspective of like, I always tell people, I'm like, here's your gut, and then there's like one cell layer thick of cells, and then there on the other side is the immune system.
Yep.
And, you know, if that gut is in good shape, then everything's talking like they should, right, and sensing, and that should be there. But then if things are going awry in the gut, then that gets the immune system on high alert, and then those alarms kind of go off.
Yeah. And that immune system in your gut is communicating with your nervous system. So those little tiny enteric nerves are in there, and it's all communicating, right?
Yeah.
Everything is communicating, trying to tell you, okay, what have I just taken into my body? And is that something that's going to promote health, move me toward health, or is it going to move me in the other direction toward disease? And obviously pain can be part of certain disease conditions.
Yeah, and I feel like it's important to say, like, a lot of what we're talking about is what's happening on a long-term basis, what we're eating over, you know, months to years. And obviously, like, the occasional food that's not perfect for you is okay. You know, nobody's 100% perfect all the time.
Yeah.
But I think what we're saying is this is what can go awry when maybe it's that standard American diet that we're seeing. And, you know, I call them like the whites, tans, and browns, the devoid of color.
Yeah.
The body's not built for processing those foods necessarily.
That's right. And I think that's a really good point, because people are led to believe that this is food.
Yeah.
And there's some kind of nutrient value to it, where the standard American diet is really nutrient poor. Mm-hmm. And when people eat processed foods over a long period of time, we know that that can be one factor that's contributing to their pain.
Yeah.
So processed foods ramp up pain.
Overfed and undernourished with those colors. So are there any other ways that nutrition affects brain perception?
So your gut bacteria is responsible for releasing vitamins, right? Our body needs those vitamins, especially B vitamins.
Vitamins, vitamin K.
Yep. All those are really important for your mitochondria, which is the powerhouse of your cell.
I feel like we could have a whole other conversation on that.
Right. And your mitochondria is most dense in nerve cells and muscle cells. Mm-hmm. The two tissues that we really focus on when it comes to pain relief. Also in your gut, there are neurotransmitters that are produced. So we think of the brain as producing, you know, neurotransmitters, but your brain's pretty smart. Your brain doesn't really want to work too hard. Your brain wants to conserve energy. So instead, what happens in the body is your gut produces neurotransmitters like serotonin, which are involved in pain modulation, if you will. And the more you shift toward a whole food diet, the more likely you are to produce healthy serotonin, which modulates pain. The more you move to the processed diet, the less likely you are to produce those kind of pain-relieving chemicals in the gut.
I was shocked when I learned that. Like, I feel like that needs to be shouted from the rooftops.
Yeah, well, you know, it's a good point, because I think when we think of serotonin...
Yeah, those are feel-good hormones.
Yeah, we think of depression.
Yep.
And then we think of, oh, well, there are drugs that help people with their serotonin.
The SSRIs.
Yeah,
Yep.
And what the SSRIs really do is they're selective serotonin reuptake inhibitors. So whatever serotonin that is produced, they're inhibiting the uptake, so you have more of it kind of in the system.
Like, right? Help it stay around, basically.
Yeah, and what we do as physical therapists who are also working in nutrition is we help people understand that they can produce their own pharmacy in their gut, and those chemicals that you produce through diet and nutrition alleviate pain way better than any of the pharmaceuticals that are out there.
And I always like to say, like, the body is inherently so resilient, and we just need to give it the input so that it can do those things, right? Like, it naturally does do those things if we give it, you know, it's that whole gas in the tank analogy. If we give it the right gas, the car will run properly. It's that whole kind of thing. It's like we're just often not giving it the right type.
That's right. And we understand feedback loops. Mm-hmm. So if we're using a pharmaceutical medication, which I'm not against, they have their place.
Yeah.
But if you're taking that for a long period of time, the signal you're sending your body is you no longer need to produce serotonin because this pharmaceutical agent is taking its place. And that can become a really slippery slope for a lot of people.
That's interesting.
Yeah.
What would you say the role of the gut microbiome has to play in this pain modulation?
I think it's underestimated. You know, we turn to pills first and foremost. The average physician probably receives about 7 to 9 hours of nutrition in school. And most of that,
like if that.
And most of that's really centered around how do you test for blood sugar and what medicine do I prescribe for high blood sugar? And that's important again, but we need to start using nutrition as a first line intervention along with the other lifestyle interventions instead of last line because it's safe, it's effective. And the other part is that people actually like to talk about food. As long as you're not approaching it in a way that's very restrictive, we all enjoy eating. We eat 3 times a day. It's part of our culture. It's part of our traditions. It's part of our holidays.
Yep.
It should be part of our health as well.
That's a really nice way of putting it. Talking about the gut microbiome, it's like, it's fascinating. And also that's the fun part because the gut microbiome loves variety. And so it's like, hey, can we eat more colorful foods? Can we eat more variety? And then you're right, the conversation is more of a let's crowd in rather than like, what are we taking away? What are we taking away? Which maybe feels restrictive sometimes.
Yeah. And there is evidence for elimination diets where that restriction message often, that narrative often comes from. I think if we go back to the case study that I mentioned first, people often ask me, and I'm sure you get these questions too, should I go on an elimination diet?
Yeah.
And they'll bring in different types because there were probably 10 different types of elimination diets.
Yeah.
And often I say to them, do you really want to try a very restrictive diet? Or can we just try to eliminate added sugar? That's a version of an elimination diet.
Yeah,
right?
Exactly.
It's one thing that I eliminated.
And a huge lever.
And for that particular person, it worked really well.
Yeah.
Some people may need to go deeper because there are food intolerances and sensitivities, and lots of foods have different types of immune responses and will stimulate different things to happen in your gut and your immune system. So sometimes you have to go further, but oftentimes it's probably 1 to 3 things that help move the needle for people.
Added sugar. Would you say dairy, gluten?
I'd say sugar, dairy, gluten would be the top ones.
Those are huge and very common. I like that approach, though, of like, we can go there if we need to. And sometimes I think that feels better for people of like slowly easing into it. Yeah. Every person's different, right? And that's where the personalized medicine piece comes in. Yeah. But I think, we're going to capture a lot more people willing to maybe pull one thing out, see how they feel. And then you'll get the occasional person who's like so gung-ho, they pull everything out. And then they get motivated because they do feel so different. I guess you kind of have to understand what makes somebody tick first to knowing like which one is going to benefit them the most.
Yeah, people have different levels of readiness.
Yeah.
We can definitely meet them where they're at. People have also tried things before too. So oftentimes they come to us with a background and we can use that and we can say, okay, sugar may have helped you in the past. Let's go one level deeper and let's now take flour out, for example.
Yeah.
And then see what happens.
Yeah. So in knowing this, that every person's a little bit different, everyone wants to know, because we all like black and white answers sometimes, is there one perfect diet for reducing or eliminating pain?
The $1 million question. And, that's a question that comes up all the time because our healthcare system has trained people that if you have pain, here's this pill, it's this one fix. So then there must be one singular diet. And we know that's not true from a functional nutrition standpoint because we're all biochemically unique. So there's not one diet for one person, so to speak. And
Darn.
I wish there was. It'd be a lot easier. But we also have to keep in mind that chronic pain really is an umbrella term, right?
Yeah.
So under the umbrella of chronic pain, you have chronic low back pain.
Yep.
You have chronic neck pain. You have fibromyalgia, diabetic neuropathy, osteoarthritis, probably over 50 autoimmune conditions that I don't think get enough attention in the chronic pain space.
Which are also different from each other.
Which are all different.
Yeah.
And then a lot of our patients and clients, because they've been struggling for so long and haven't found a solution, they have more than one of these things. So they have osteoarthritis and they have fibromyalgia. Or they have fibromyalgia and they have chronic low back pain.
Yeah.
So, from a scientific perspective, we know this as clinicians. Each of those conditions should be researched individually when it comes to nutrition. But there are things that we're talking about today that apply to to almost all conditions.
That's empowering too, because so I specifically in the pain world have done more research into specifically osteoarthritis and rheumatoid arthritis.
Yeah.
And even those recommendations vary slightly. You know, there's a better research for the Mediterranean diet for rheumatoid arthritis than like the research isn't quite as robust for OA, but you know, that's still a really healthy, whole foods, beneficial diet. So it's not necessarily like the wrong thing. So, you know, what are all the options? Mediterranean diet, that's the most well-studied, the longest studied. I don't think anyone's disputing that that's beneficial for most things.
Foundational. When you look at nutrition science,
Yeah.
Foundational across a variety of conditions as well as chronic pain conditions.
Yeah.
The one thing I want to bring up about the Mediterranean diet is that speaks to a lot of people's cultural heritage. For some people, because we want to make sure we, you know, address people's culture, religion.
Yeah.
Sometimes the word Mediterranean doesn't necessarily resonate.
Yep.
There's a great website, if I can point to your listeners and viewers.
Please.
It's called Old Ways.
Okay.
I think it's oldways.org.
Great.
And what they do is they take the Mediterranean diet and they modify it for different cultural perspectives and tastes.
That's incredible.
So it's a great resource for clinicians. People say,
huge.
well, you know, I've heard this because I'm Italian. My background is primarily Italian.
Yep.
People say, well, I'm not Italian, so I didn't grow up eating a Mediterranean diet. But the foundation of the Mediterranean diet is similar across other diets as well.
They all have similar foundational principles, basically. Yeah. And that is important to keep in mind, the cultural sensitivity and what is someone actually going to put into practice instead of giving them a list of things that they've never had before and probably won't try on their own.
Right. But you're right, though. There's a lot of nuance
Yeah.
in different diets, and we should probably talk about some of those. So as we start to move away from the Mediterranean diet, then we have options, which is great, too.
Well, yeah. So then there's like that whole spectrum, right, where you go, are you eating meat or are you not eating meat?
Right.
You know, and sometimes yes, sometimes no. There's vegan, there's vegetarian, there's pescatarian. You know, there is the low carb, there's very low carb, there's the paleo, there's the autoimmune protocol. There's all of those things. I almost say try things on for size and see how it works. I mean, obviously look into the research with your own specific condition.
That's right.
Under that umbrella, but I think people also are more apt to try certain things that maybe aren't like wild changes too. Yeah.
People have a different palate too for things. So we keep those things in mind. But there is a diet, I believe, serves everyone. That serves everyone's health. I've had a lot of success recently with pescatarian diets. Watching a couple patients who said, I don't want to eat any meat for various reasons. Some of them religion, some are just more kind of sociocultural that we have now around that topic.
Yep.
And they do really well on pescatarian diets because they're high in omega-3 fatty acids.
So I actually, you might not know this about me, am a really big tin fish fan. And I'm like shouting from the rooftops over on Instagram.
I think I saw that on your Instagram post, actually.
Well, every Monday I make a mackerel recipe, and I call it Mackerel Monday. Sometimes I shout out sardines or something, so
sardines.
I have to figure that out.
I love tin sardines.
They're so good. But the thing is, I didn't start out liking those. Like sardines, the first time I tried them, I'm like, disgusting. Mm-hmm. So I'm like, I've willed myself into liking things by repeated exposure because I learned how healthy they were. Yeah. And I feel like it's not like I took my first bite of sardines and was like, this is the best thing I've ever had. And now when I eat them, I'm like, love these, you know? So I think like I do like to tell people that sometimes it does take a little time, repeated exposure, adding other really good flavors like garlic and getting your olive oil and herbs and things in there. But the tin fish are, and that's probably why the pescatarians are doing so well, is because of they're so high in omega-3s. I love that they're a good source of protein that's satiating. You got your olive oil in there, and that's helpful. And there's a good source of calcium. Mm-hmm. And I always tell people they're prepared. They're already ready.
It's easy.
You know, like that's what I like, I think, most about them.
One of my favorite lunches is either a piece of salmon or sardines. Yep. And the sardines are actually easy. You just open the salmon. You have to obviously cook or buy prepared. Yep. Sardines you can just open. Take a 50-50 mixed green salad, can of sardines on it. Yep. Olive oil, whatever vinegar you choose, some blueberries, some goat cheese, a little bit of pepper, a little bit of salt, and you have, I also chop up some Granny Smith apple, which I love.
That would go well with that.
Little carrots in there. Now we're talking about having more of a plant-based, obviously, meal that is rich in omega-3s, rich in antioxidants,
All those deep, dark, pigmented colors.
Yeah, everything, every color you see on some level has an antioxidant that will contribute toward pain relief.
And it's antioxidant. So we don't want oxidative stress, if you've heard that word, oxidative stress.
They're also anti-inflammatory.
Yeah, and the polyphenols and the blueberries and things like that. I think it's more fun to eat a plate that has all the colors on it. You know, like you don't have to be a kid to like color. And also, I think it's easy to translate into, hey, eat the rainbow. You know what I mean? And I do think that's something that kind of goes in like one ear and out the other with people.
Yeah.
So then it's like, okay, what are the resources to translate that? If we do just tell people, let's get more of those colors onto your plate, it does kind of simplify things.
It does. And then I've also learned to give people a chance to let their palate accommodate as well. Because if they've been eating a standard American diet, which is mostly processed foods, that's important. They're used to things being very salty, very fatty, and very sweet. And one of the great things about an elimination diet is when people go on an elimination diet for a period of time and they come off those foods and then they go back to it, which I've been on multiple elimination diets and something always works its way in.
Yep.
Right. And you come back to it and the first thing you say is, wow, that's really super sweet or that's really salty. Because your palate, obviously the reward system in your brain, right? We're talking about the brain and pain.
Yep.
Your reward system starts to change and says, I no longer find this super sweet cookie palatable, but I actually find this salad that we're talking about actually more palatable.
The money piece right there is like slow, sustainable changes over time, and it's the overtime piece.
Yeah. Adherence is really important.
Yeah.
Right? We can't leave adherence out of the conversation. So let's say we did research and we found that the Mediterranean diet is the absolute best diet for osteoarthritis. If someone can't adhere to it, then we have a different challenge in our hands.
Yeah. It's so hard to navigate in this day and age. Like you do almost have to be a detective in staying away from the marketing and all the information shouting at us to be like, this is healthy and this is why. I almost feel like if something's telling you why it's healthy on the label, it probably isn't. Because an apple isn't sitting there shouting at you saying, eat me, I'm healthy. It doesn't have a label.
So talking about labels, I was in Europe a couple of weeks ago for a summer break.
Where in Europe?
I was in Spain but every time I'm in Europe, there's something that strikes me. Is that in Europe, they're able to make a claim on olive oil that it can be used to treat, not prevent, to treat heart disease or cardiovascular disease.
Wow.
And then we come back here to the United States, and I'm like, why is it that we're prescribing opioids, but we can't prescribe olive oil?
And olive oil is cheaper and way more delicious.
And it has a really important polyphenol in it.
Yep.
That's extremely anti-inflammatory.
That's fascinating. I didn't know that. And that's why I think we can learn so much from other cultures. I love the blue zones. A lot of those cultures are doing their due diligence, I think, in, reducing pesticide exposure and, reducing marketing for kids and things like that. But that's fascinating with the olive oil.
It is.
And it probably tastes absolutely delicious, too.
And people would say, well, that claim may be for cardiovascular disease, but you're not saying that olive oil is curative for chronic pain, and that's not what I'm saying. However, we know that there's a bidirectional relationship between something like osteoarthritis and diabetes or osteoarthritis and cardiovascular disease.
Right.
Why? Let's try to make the connection there. If I improve my cardiovascular system, how could that possibly help my osteoarthritis? Well,
then you can exercise.
Yeah, and our joints have a very poor blood supply. Nutrients arrive to our joints, our cartilage, through diffusion.
Yep.
Right? So there's no blood that goes there. It has to kind of pass through this membrane. If your arterioles, the very small little arteries, start to deteriorate because you have cardiovascular disease, that means your joints are receiving less of a blood supply and receiving less nutrients. Oxygen obviously being one of the most important, but all the other nutrients that we're talking about as well that are important in the diet.
That's a great point.
Yeah.
And there's this whole metabolic subset of arthritis that's coming out in the literature, which I find to be fascinating. And I think that probably points to that. Tell me more about that. They're basically saying, okay, so if we're having this low level, smoldering, kind of chronic body-wide inflammation, that it ends up in the joint. The research is still not super robust on it, but they're finding modulating diet can impact the pain in the joints, which makes sense.
People come to me oftentimes and they say, my joints are really stiff in the morning. What should I do?
It's textbook OA.
Textbook OA. And for years, I was like, well, you need to start to move and you do. You need to obviously
motion is lotion.
Motion is lotion. That's all important.
Yep.
How about hydration?
We wake up like raisins, I tell everyone.
And a lot of people, it's funny, some of my older patients especially don't like to drink water in the evening because they have an urge to go to the bathroom at night.
Yep.
And they don't like to get up because it disrupts their sleep. So they're waking up dehydrated. That's the first thing I'd like you to do in the morning is I'd like you to have 2 glasses of water. Before anything, before coffee, before anything else you do, have 2 glasses of water.
I love that. That's pragmatic. That's simple.
Simple.
Yeah.
Because our joints are mostly H2O, mostly water. After that, if it's not part of your diet, which it should be, it's always a food-forward approach, right?
Yep.
We talked about omega-3 fatty acids. It could be really important for some people to supplement with that.
Yeah.
First thing in the morning as well, right? Let's give your joints some oil so they start to move.
I like that analogy.
Yeah.
Because, if you think about oiling a joint, it feels like it'll loosen it up, like it'll work better.
It feels good.
Oh, pour some olive oil on there. So in addition, that can kind of translate us into foods that have like analgesic properties. I know the omega-3s are on that list, but can you give us a nutrient specific, can you give us a couple more examples of some of those in the research that have pain relieving properties? Yeah,
I mean, there's many. So the omega-3s are really the top of the list just because as Americans, we have a pretty high dense omega-6 diet.
Yeah.
So we want to start to shift toward omega-3s, very anti-inflammatory. And there are some studies that show that just providing 2,000 milligrams of omega-3s are really good for joint health.
Yeah.
So obviously, food first, you can supplement next. Curcumin, the spice found in turmeric, is really important as well. Again, you can supplement with that. You can add it to food. If you're adding it to food, it's lipophilic, means it likes to be absorbed in fat. So for it to cross the barrier in your gut, it needs to go with a little bit of olive oil or other fat in food. Even a little bit of coconut oil is fine too.
And a little bit of black pepper.
And a little black pepper is really important.
That piperine helps.
Important as well. Really, a lot of your vegetables have pain relieving properties to them. All your cruciferous vegetables, all your green leafy vegetables, all very anti-inflammatory, antioxidant. So those are kind of like the foundation. Blueberries have really strong antioxidants as well. So these are the kind of foods that we want to start to add, kind of weave into our diet bit by bit by bit.
And they're delicious too.
And they're delicious. And once you start eating that way, you very rarely go back to a standard American diet.
It's true. And I like what you said earlier about how, you start to slowly change things and then your body craves that, right?
Yeah.
Like I want nothing else but mackerel with my pasta now. You know what I mean? But it wasn't always that way. But I think most people can get down with blueberries.
Yeah.
There was a really interesting study. I think they used blueberry powder and, supplemented that in a drink. And then adults with arthritis, osteoarthritis, I think it was in the knees, drank it and had, statistically significant improvements in their pain. And I think it was even actually quality of life, or they did like the WOMAC and the VIS scale. It was on multiple scales. Yeah. So they've done studies with strawberry powder and blueberry powder, just getting the whole foods in there.
Yeah. And, supplementation has a place.
Yeah.
We all have a busy life, and sometimes we can't eat optimally all the time. So there's a place for supplementation as well. Powders, you're talking about powders.
Yeah.
Have a place, definitely.
Yeah. And I feel like sometimes those higher dose curcumin can be effective too. But I really also like to try to be as cost effective as possible too, because you don't want to be cost prohibitive. So like food, and this is why I think food is so interesting to talk about. We could talk about it all day long, but we're saying food is information, food is fuel, and I do preach that and I believe that. And yet it's so multifactorial in terms of, people's food beliefs. How did they grow up with food? Was there an abundance of it? Did they not have enough? That all impacts how people are eating nowadays too. But how do you address the psychological aspects of food when you're counseling practitioners to help patients with that?
Yeah.
Piece?
It's a great question. I mean, we live in a noisy world, and there's so much information out there. And even some of the information that's coming from the government really isn't the best health promoting information that we can have. We know that now. Like earlier, you talked about how it could take anywhere between 1 to 2 decades for that information to get into our educational program.
Yeah.
I really think the same thing is happening at our government level. It's just taking way too long for the latest nutrition science to hit the guidelines, which means it's not getting to the general public, basically.
Yeah, it's not getting the airtime it deserves.
Yeah, I mean, sometimes people come in and they are following someone on Instagram or they purchased a book. So they kind of bring these like great kind of on-ramps for you to start to work with.
Yeah.
Eventually, as you work with more and more people around the realm of nutrition, you realize, wow, this is just not about food, that there's also an emotional and there's a cultural perspective that we have to take into consideration around food.
Yeah.
And there's a body narrative in the United States of America and other countries that we have to be sensitive to as well.
Yeah.
And it's important in the pain world, especially because do we have evidence that maintaining a healthy weight helps with pain? Yes, we do.
Yeah.
Should weight loss be the thing we focus on solely? No.
I agree with that.
I've had patients whose weight hasn't changed, but the quality of their diet has changed.
Yeah.
And that's what's been the difference.
And it's that whole fat mass versus lean body mass.
Yeah, and let's not forget, there are some people that can have a relatively quote unquote normal BMI and still be eating, for lack of a better word, crap.
The skinny fat, we call it.
That's right.
Yeah, you're right. Like weight is not the whole picture.
We shouldn't discount it.
Yeah.
If people are morbidly obese, there is, we're talking about a biopsychosocial model, right?
Yep.
There are biological factors in pain and obesity.
Yeah.
There are psychological factors in pain and obesity, and there are social factors in pain and obesity that we have to take into consideration when we're working, because I'm working with people from a whole person perspective, not just from a weight loss perspective.
And that's such a hot button topic now in today's world with the GLP-1s and things like that. And could it be a yes and? Like, yes, maybe we need other modalities, lots of tools in the toolbox. We're not saying anything's off limits. We're eating 3 times a day. So let's use that food to help you get towards your goals more effectively for long term. Something that you're doing quick is going to lead to like a quick regain, you know? So
and we know this working in pain management, that we, I think as physical therapists, look at pharmaceutical medication as a tool that typically is relatively short to moderate term. Long term, we want to start to taper off that, right? Taper off of opioids. And as someone's tapering, we prop them up, we build them up, we empower them with the lifestyle things that we're talking about. I believe the same applies to weight loss medications as well.
Yeah.
They're tools, but we still need the lifestyle to support the person.
Yeah, we want the long-term solution.
Yeah.
So do they, Nobody wants to be on a medication for their whole life. You mentioned opioids, and you mentioned opioids previously. That's always been a huge conversation in the pain management world, and there's a lot of side effects and concerns with that. How, as PTs, is there a world where we can use nutrition to help patients kind of taper off opioids? And how would we do that? There
is, back, shortly after the height of the opioid epidemic, and some, jurisdictions started to say, hey, we're going to now start to taper people down. And some people were tapered down rather drastically. That drastic tapering not only made their pain worse, but it also negatively impacted their mental health.
Yeah.
So I watched that happen, and I was like, okay, we're taking people with long-term chronic pain who have multiple comorbidities. Many of them have systemic inflammation, and now we're essentially pulling the rug out from under their feet, and we're taking their medication away from them. That's completely wrong. Yeah. That's not the way to go about it.
Then there's no tools.
There's no tools. So the right way, when we're looking at this, is okay, let's give someone the education around what the long-term, potentially harmful side effects of opioids are on your nervous system.
Yep.
And then let's start to prop them up with things that are healthy, like nutrition, like movement, like stress reduction, like improving sleep. And people respond much better to that. And they're more likely to taper off in a way that feels good to them. Mm-hmm. They feel supportive, and they also feel good in their body and their mind, versus just like, we're just going to take a medication away.
And I feel like that is, again, what you're doing there is you're putting the control in their hands. And I think that what you're speaking to is empowering them. And then it's that positive feed forward of start to move, start to feel better. Now I have the energy to maybe eat the sardines that I never thought about eating before. I mean, like you just kind of open up this like space where if there's, I think pain just, there's so much noise with pain, right?
Yeah.
So if you can toggle with some of those areas and then reduce that, just, turn one of those dials down, then there's room for making positive changes.
That's right. And food is empowering for people. So 3 times a day, you can choose to do something that will start to bring your pain levels down.
Yeah.
Once a week, when you go to the supermarket, you can choose to put things in a big, huge shopping cart. And obviously that comes home in your refrigerator, in your cupboards. And then you fill your home with things that are health promoting and obviously things that promote pain relief. So all that is very empowering.
I just want to like put a pin in that food can be used to help lower pain. I think it can't be said enough. I think people still don't know that. And so that's why I'm so appreciative for you for educating people on that.
We'll go back to the science for a moment there in that, because there is still, people ask, well, is there evidence? There have probably been 6 systematic reviews now and meta-analyses, which are really large studies where they look at thousands of people, typically in randomized controlled trials, and they look at what is the impact of shifting toward a whole food diet, essentially. And time again, it's that changing someone's diet does lower their pain intensity, does improve their mood. Typically, that's depression. Does improve their anxiety or reduces the anxiety. It often goes along with that. Does improve C-reactive protein.
The marker of inflammation.
Marker of inflammation in the blood, which is really easy that many primary care providers can run, and some PTs are even running tests like this now as well, which I think is really important.
Not in New York.
Well, as we move toward primary care, these are the things that we're talking about, right?
That'd be incredible.
We're moving there rapidly.
Okay.
And there are companies that are actually supporting physical therapists to do these types of things now.
Okay,
right? That's good. We want that because we want to be part.
Yeah.
So if a patient can come to us, direct access, or through primary care, which we have now in the state of Utah, and there's another kind of version of that in Montana, where physical therapists are looked at as physicians under the workers' comp system.
Wow.
Yeah. So
I didn't know
with that, some scope of practice has to change. But we're moving in that direction steadily because it's effective and it's cost effective and it's efficient.
Yeah.
And the public is asking for it.
Kind of what we were chatting about earlier is that and this is why I think this stuff works, is because we're spending that 2 times a week with that person, and maybe we're spending, if we're lucky, half hour uninterrupted, right, with them, and while we're running them through exercises. Hey, did you try out that recipe that I, gave you? Or even just chatting about like, hey, what did you have for breakfast today? Like you can start at the most simple level, but having just those conversations increases even just, oh, maybe I should pay attention to what I'm eating. It doesn't take much. And I felt like I know I can do this, but I don't know what to tell people, right? Because I was like, eggs, no eggs, brown rice, white rice. So I did go back to school to learn the science, but I don't think every PT needs to do that. It's general nutrition advice of whole foods diet, mostly plants, fruits, vegetables, nuts, seeds, maybe the oily fish if we're going for fish. It's a lot of the like really basic principles, and just starting to have those conversations is going to help one person at a time. It
is. And we should also keep in mind that physical therapists have the clinical skill to counsel people on lifestyle, and that includes nutrition. And we have evidence around that as well.
Yeah.
So it's not like we can just counsel on exercise. We can counsel on nutrition as well.
Can and should,
Can and should. I mean, that's when I go, so I talk at some DPT programs. And look, not every PT is going to embrace nutrition, and that's okay. Just like every physician doesn't embrace nutrition, but more and more are interested. And I think it's winding up in the DPT program more. And let's not forget the public wants it too. So we're here to serve the public, not the other way around.
And people are confused. I mean, people ask me questions all the time.
People come in with sometimes some of the wildest things. And I'm like, we have ways to go here before people really embrace where they should need to be.
That just shows how much basic information is needed.
Yeah.
And, food being so beneficial, I think we were saying like it's benefiting systemic inflammation, it's benefiting weight, it's benefiting mental health, it's benefiting gut microbiome. So like this one modality has all these, I'm just calling them, beneficial side effects, right? Where like the side effects, it's a very low risk, high reward intervention. And again, if we're eating 3 times a day, we have so much room to kind of play with that. And so, if we're talking about doing something that's really kind of only going to benefit people, why not try it?
Yeah. So you mentioned the inflammation piece, and I think it's important that we circle back to that for a minute.
Yep.
So there are conditions that are more systemic or more systemic inflammation. Rheumatoid arthritis, I think, is a pretty good one. Mm-hmm. Many of the chronic pain conditions, for example, chronic back pain or fibromyalgia, we're talking about very low level but persistent inflammation that is in the central nervous system.
Huge.
Right. So we're talking about neuroinflammation.
Yeah.
Right. We talked about neuroimmune before.
Yep.
For the pain science people out there, we're looking at educating people and providing them with basic cognitive behavioral skills. Your nervous system needs that nutrition to grow those new synapses, right? Neuroplasticity.
Yep.
That's really important in the pain world. Neuroplasticity happens because you have the nutrients to support that.
I haven't thought about it that way.
Yeah,
before.
Your nervous system doesn't grow on its own, right? It's like a tree.
Like anything else.
A tree's not going to grow unless you water it and give it fertilizer, obviously proper nutrition that the tree needs or the flower needs.
Yeah.
Your nervous system is the same way. So if you want to educate people on pain, you want to use psychologically informed or cognitive behavioral skills, you have to do that on a nervous system that is ready to receive that and make those connections. With chronic pain, our nervous system is very sensitized.
Central sensitization.
Central sensitization. So nutrition has the ability to calm that central sensitization.
Which again is helping at so many levels.
Well, you mentioned it before. You mentioned the vagus nerve. Mm-hmm. So what nutrition does with the vagus nerve is it helps with that descending input that's coming down to not only to your gut, but also other organs.
Yeah. It's so fascinating when you start to get
the body's great, isn't it? Isn't it amazing?
Well, and I like that this is like, we're talking about all the systems working together, and that's exactly what they do, right? And so it's nice to say like, we can do these things and it's helping a lot of different pieces of us instead of like siloing, specializing, and I think getting farther away from like you're treating people with a whole body approach and that's it. Yeah,
I mean, a whole person approach is really what we should be doing as physical therapists. And as physical therapists, we should be taking a multimodal approach. And I think diet and exercise are obviously huge. It's probably the 2 most important ones.
Yeah. In your book, and I like that you also have the food piece, you have the movement piece, and then you have the brain piece too. And then those other lifestyle strategies of like, hey, if you're not sleeping, you're probably not going to make the best food choices. And so that's where like there's all these inputs come in.
Yeah, and people, like if they read that book or come across my work, I talk a lot about mindfulness.
Yeah.
Mindfulness is a great way to lower the sensitivity of your nervous system. Mindfulness is also a great way to approach changes in diet. So, for example, mindful eating. Mindful eating, yes. Where you can savor your food, become aware of what you're eating, turn off all the screens, which we're all in front of constantly now, and just focus on the food and obviously the person in front of you that you're maybe eating with. And savor that food. Take time. If people need a resource, I have a good colleague. Her name is Dr. Susan Albers. She's a licensed clinical psychologist. And her specialty is mindful eating. I believe her website is mindfuleating.com. Or just Google Dr. Susan Albers. And she has wonderful resources to help people with mindful eating, this is all a part of what we're doing. And if we're eating mindfully, then we're also digesting and absorbing the nutrients. And so I always say too, like if you're going to do all this work to bring in those good inputs, you also want to make sure your body is going to take that and use it for what it should. So we do need to break those things down. We do need to be chewing our food long enough and well enough so that we can actually not only digest but also absorb the nutrients. So that's a great point. And it's more fun to eat mindfully, then you're like, this tastes incredible, So it's a lot more fun way to be. You really only need curiosity for change, I think. But tell us how we can find you, your courses,
and your books and things like that?
Yeah, I mean, the easiest place is online. I have a website. It's integrativepainscienceinstitute.com. I have a podcast there. I have books and resources. I have practitioner training programs and resources for the public as well.
Yeah, I am so jazzed to do the functional nutrition for chronic pain, because that's exactly what I need. Like, I think I Googled one day, I was like, I can't believe this actually exists, and I'm getting 36 CEUs for it. Like, so thank you. I just want to thank you for that.